This is It's Not In Your Head podcast with Dan and Juz. Dan is a doctor and Justine a pain coach. We've come together to find ways to manage complex chronic pain better for both patients and providers. Hey there, welcome to another episode of It's Not In Your Head podcast with myself, Justine Feitelson and Dr. Dan Bates. Hello there, Dan. How you doing today? Good. We're both hanging on. Dan is almost to the finish line of vacation time.
I'm so done. I'm so done.
If you're watching on video, if you're watching on video, you will see Dan a little more cooked than normal. I always secretly revel a little bit when Dan's not, I don't say struggling, but just like
because you feel all the time.
Because that's how I feel all the time. He gets a little taste of it, but I'm also doing less. We just have different capacity limits. So it's all fair, but it is appropriate given that on this episode today, we're going to do a little bit of a special, take a break from the procedures that we've been rolling out and touch on the holidays, which if you're a pain patient and you deal with chronic pain, or you are a clinician who is overwhelmed from a scheduling perspective at this point in the year, this is a good one to listen to. So we'll kind of talk about some of the different challenges, physically, emotionally that come up when trying to manage pain and also do the things that you want to be able to do and experience, over this slightly more special time of year for most of us. And we'll talk about how to manage those stressors and mitigate those things that are both unique to the holidays and actually common to other times of the year, but just particularly challenging sometimes in ways when everything gets crazier.
What Judge is trying to say is that when you're going to go see your crappy relatives, we have some strategies.
Listen to this first. Yes, exactly.
Mostly.
It will mostly help, not totally.
Or at least a bit.
Mostly.
Or at least it'll be vaguely amusing.
Yeah.
When you think about it.
Yeah, and it's not just the stress of that too, right? It's also the grief and the sadness. And although there's a lot of joy during this time of year, it can feel very, very heavy because sometimes the challenges and the sadnesses that you are dealing with then feel highly contrasted to what it feels like the rest of the world, is going through and feeling. So it's not just about the loss of routine and the difficulties in maintaining yourself. It's those emotional pieces that make this time of year difficult, but are not as bad sometimes as it feels like when we're in it, if we can change our perspective around a little bit. So we'll go through some actionable strategies that you can integrate and go from there.
We've had a couple of different episodes throughout the year looking at different ways that you manage flares, travel, family stress. We'll tap into those again. Take us through the 5-step plan for managing flares, because I think, the most important thing is that everybody knows you're coming into a period of time of stress, a period of time of change in routine, a period of time of maybe decreased activity and a little bit more letting things go. And so the likelihood that people are going to have a flare is, higher. So what are the strategies? So if you go in with the knowledge, hey, I'm going to have a good time, but I might be going to flare afterwards. How do you manage that? So, Jaz, what are the 5 points?
Yep. And everything you're talking about sounds familiar, right? So although, yes, it's the holiday season, it's the same stuff that happens during other parts of the year, and it begins with trigger or stressor. Then that is followed by a loss of routine, just like Dan's talking about. That loss of routine leads to worsening pain, right? Your capacity changes, you bubble over your pain threshold more, your coping drops off. Then you find yourself in the hole. That is where you don't want to be ideally, and mitigate things earlier if you can. But if you find yourself there, notice it, recognize it. Oh my God, it's happening. And then have strategies and things that to go back to that will help dig yourself out. So it's not different than during other periods, but with the holiday season, it's heightened, right? We sort of have that too much wine, too much food, not enough activity. And for those of us in America, I would say, well, globally with the weather change, right? But we all kind of experience this October slide. A lot of patients talk about with the start of Halloween into then November and December. So if you can catch these things starting to happen in October and early November, you'll have an easier time actually.
Which will be good for next year, because considering it's December now, what are we?
Well, I know that's what I was like. Our holiday episode, if you're in Australia, is okay. It's coming out before Christmas and New Year's. But if you're me, you've been dealing with this already for a couple months. So noticing those things falling off, and then actually integrating the things that change them. So you're not helpless and just along for the ride is really, really important.
If you are going to be in social environments in which you know that it's stressful, sit down, have a plan about how you're gonna manage that social environment. Have maybe a friend buddy, a partner buddy, a family buddy that can assist you to tap out when you need to tap out, and have somebody that makes it fun.
Somebody that makes it fun. Yeah. One person that you can kind of buddy up.
Have a plan to deal with those stresses. I think we're about to talk a little bit about travel as well, but making sure that you do have a plan in place and you've just thought it out. Just thinking it out can be a way of simply decreasing the stress of what is probably going to trigger off your pain or a little bit of a flare.
Yeah, and it's the same patterns, as at other points. And it's just the reality of you have more obligations, you have less rest. So the things that you're better at typically with pacing get a little bit fuzzier, and realistically you can't do everything. And I think that's one of the hard parts of the holidays is accepting that something's got to give and prioritizing what really, really matters so that you feel like you hit the most meaningful pieces, but we're able to allow yourself to have a little more downtime and recovery between things as they accumulate.
Like loss of routine's the other major thing. What do you do to try and maintain routine?
Well, depending on what piece of your routine has fallen off, right? If it's sort of recovery, sleep related, sure up the bedtime, wake time. If it's sort of that staying out piece of things, that's become inconsistent. If it's the movement piece of things or getting very sedentary, what I'm prone to isn't sleep, wake time getting crazy. It's paying less attention to my nutrition, right? Sneakily just missing macronutrient targets, protein falling off a little bit, and sitting too much and movement falling off. And that is then what really gets you in some of those weakness spasm cycles from a physical perspective. And for me, then integrating stability stuff and doing that in a way that doesn't overwhelm me, but I can sort of start to pepper in more and more is how I build back. And then I put the structure back in my day that allows me to spread things out more evenly, right? And kind of have those pressure release valves and built-in flexibility that I may have gotten away from when I'm overwhelmed and trying to do a lot in a short amount of time.
Yes.
Whether it's work or play.
Almost my loss routine has been, it's where coming up to holidays, just having to get everything done, just working massive hour days. Like I think I did 16 yesterday. And it's just, you're pushing. And I think that, I'm lucky enough that I don't suffer chronic pain, but right at the moment I'm pretty tired. And if I did have whole stack of pain going on at the moment, there'd be pretty obvious trigger, which is working way too much to be able to get everything done before the couple of week holiday, during which I then sleep because I'm too tired.
Well, right. And the reality is with chronic pain, you can't keep just pushing through, so your motivation's going to wane. Your discipline is going to change at times. And if you can at least get back into those key doable things so that you don't get into this ongoing cycle of deconditioning and then beating yourself up for that happening, which does not feel good. So if you're staying put, get into your normal routine. And if you're traveling, try to integrate those things and keep as many pieces of your normal, day-to-day life as you typically do.
I was going to go segue to how do you manage worsening pain?
Movement.
I think the point I want to make here is you need a flare management strategy. So there's a couple of things there that you can think about. So you've got your conservative stuff. So that might be, I'm going to use my ice packs. I'm going to use my heat packs. I'm going to use my bracing. I'm going to use my
soothing
my massage. I'm going to use some mindfulness, things along those lines that you have that are conservative strategies that, as you recognize that your pain is starting to increase, you can just start implementing those. And it's not the time to, forget to take your heat back with you as you go off to see mum and dad. The other thing is then thinking about what sort of medication strategy you may have in place to be able to implement. So, I think I've said this before for a number of patients. I I get them to use a combination of an anti-inflammatory and then a medication called amitriptyline. Both one, the anti-inflammatory is dealing with the inflammatory component, and the amitriptyline is an anti-neuropathic medication. And so it's then dealing with the neuropathic side of a pain flare. And so you've then got a short-term management strategy that you can implement. So talk to your doctor. Those medications may be appropriate, they may not be, but there's variations on that you can look at so that you've got a couple of things that you can implement. I kind of encourage people to stay away from opioids. So, the management strategy of I'll just push my endone up, or I'll just push up my oxy. Yeah, maybe not. Maybe look at some other strategies that are treating different mechanisms of pain and see if you can get that sort of stuff under control.
Yeah. If you're a patient, you can kind of think about yourself and go, well, is it lack of capacity that's driving this, right? Poor sleep, poor circadian rhythm. Is it increase in stress, where then you'd want more of the down regulating, more of the mindfulness? Is it getting sedentary, where then it's, from a weakness spasm perspective, it's getting more of that neural drive to some of those areas and sitting less. So match, the conservative therapy as best as you can to the thing that's impacting.
And I think that, let's say you miss your window, you end up in a big hole of pain. It's okay. I think the thing to focus on there is that, you know what, everybody's been in a hole before. And if you focus on the fact that, you've got out of the hole multiple times before, you got out of the hole before, you're going to get out of the hole again. And it's terrible where you are at that moment, but you do get out. I'm going to get out of this. I went through this last time. It lasted 2 days, 4 days, whatever. I came out of the other side, the other side. And then while you're there, just tapping that person that's willing to sit with you in the dark, just go, hey, you don't have to do anything.
Yeah.
I just need you to be here. And if you've got that person around you that you can tap, you have a strategy there together, then that allows you to then, walk through the hole, dig yourself out, and have that person help pull you out at the top.
Yeah. And I tell people all the time, slide backs are part of overall progress. And that's just, 1 step forward, 2 steps back, 3 steps forward, 5 steps, it's just when you're in that slide backward, it doesn't feel good. But if you can stretch time out, just like Dan's saying, and remind yourself of what you've overcome in the past and that it is okay. It's not even because you did something wrong. Like, we're all just human, and holidays are hard, and nobody can do all this stuff perfectly all the time. So if you know that it's part of the process.
I have tons of people that flare up over the holidays, and they come in and are like, I did this and I shouldn't have done that and blah, blah, blah. You know what? I think that the fact of the matter is you felt good enough that you could do it. That, if you go back to, last year, 6 months ago, whatever years ago, most people are like, I'm not even trying that.
Yeah.
Because that's going to result in, terrible time.
Right. Would you have
the fact that you've got yourself to a point at which you were good enough to give it a crack, awesome. If you flare up afterward, okay, we'll deal with the flare afterwards. But glass half full is, hey, you felt good enough to have a crack. That means you're getting better. Next time you'll feel better and you won't flare as much. So let's just focus, if you can, on the glass half full. Flares end. They all end, even though we recognize they're not pretty while you go.
And as you improve, and as you improve, the way that you recover and how fast you recover from flares also improves. So yes, you slide back, but you also bounce back faster. And reminding yourself of that as well.
Yes.
So travel-wise, let's cover off on the things that are a little bit different than when you are sitting at home. First of all, hope is not a strategy with any of this stuff, let alone when you're traveling. Don't hope for the best. That does not ever go well. So go into it in as good a position as you can. Just like when you're at home, like Dan's talking about, have a strategy around things. Think about how you're going to plan and approach this before, or rather ahead of time, and put yourself in a position where you're not flaring going into it, right? So at least if you have as much capacity as possible, so you have more wiggle room when you start this difficult thing, you bubble over your pain threshold less quickly and less intensely. So think about how you can make travel itself easier, bring all of those, tools and gadgets, and like talk about my clients, the SOS bag of stuff that just makes you feel good, right? Is down regulating, is soothing. It's not the biggest needle mover on pain necessarily, but it's helping you manage when it gets higher. Just like breathing isn't making your pain go from, a 10 to a 5, but it's helping it not creep up into unmanageable levels. And you don't want that to happen when you're on a plane and not in your own environment and around strangers. That just adds to the anxiety and stress. So go back and listen to episode 26 that we did on this, as far as a whole deep dive on managing travel. The pacing episode, I think, the flare prevention and energy management episode was 21. So check that out with regards to the stuff we just talked about. And those are the exact strategies that you want to integrate into wherever you're going for the holidays. And then cover off on things like boundaries and communication, planning your recovery in advance, as far as when you're going to need some days on the other side of things. Don't go straight into work. I have done that too many times. It's not great. And it's going to be hard, accept it's going to suck a little bit or a lot maybe at different points, but you're going to get through it. And if you can create enough joy and positives, at least to make it worth it, then it's worth it. And
look, I think one of the things you mentioned previously is, particularly with travel, is going and moving through airports. And, if you've got to
use
get a chair,
wheelchair.
Just get a chair. Like, let's be honest, it is a long way to walk through essentially any airport. And so if you're not able to walk 500 meters without exploding in pain, well, that's okay. Get a chair. It's all right. Because...
And also,
it's okay. Yeah. Get a chair.
Even if you wouldn't explode in pain right then, it's the delayed downstream effect. So you have a right to use mobility devices, even if you don't need them all the time. I just did a post on this because I used my wheelchair when I went to Balboa Park and the zoo this last weekend. And it just, not having to use it all the time doesn't take away from the importance of using it when you need it. And sometimes when you actually earn more freedom and you're not having to use mobility devices all the time, it's harder to sometimes go, no, I need that for that. And it doesn't matter what other people think. So it's a form of pacing, right? Save your steps. Don't blow them in the airport so that when you arrive, then you feel like crap. And you have a right to do that as a patient. It doesn't have to be like, unless
airport
I am
steps are wasted
in the
steps.
Airport.
Absolutely.
It's fine. Wasted steps. Yeah. I'm like a bat out of hell in my chair. I'm like, woo, now who's slow? So it's like a little bit freeing. And then you just have to get over that mental part of it, but it feels better than being slow and it adding up and then that adding to the stress of the whole situation. So
all right.
Advocate for yourself. So.
Movement management. Hey, I've got some movement management.
Cool.
I'm going away with the whole family. I told my wife yesterday, sweetheart, I'm taking the boxing gear. She was like, you're what? So my son and my two daughters are going to be either running or boxing every day. I think they are looking forward to it. Training camp.
We're doing training camp.
Boot camp.
Like it. Why wasn't I invited?
With Dad.
Boot camp.
Be like, Dad.
It's the European base camp.
Dad, no. Anyway, I don't think so. But
anyway, that's going to be
the Bates version
I think it is.
of the dad's vacation.
That's the vacation management strategy.
Dad's making us run.
I like that one. That's kind of more fun. But if you're not in the vacation version of movement, because that's, you want to do what you can when you're elsewhere and still have it be enjoyable.
Movement management.
It's a little different. The regular version is, first of all, basically consistency is usually the biggest issue, and maintaining progress during the holidays is particularly difficult because of that. So be easy on yourself. And if you don't stick with your routine quite as well as you do normally, it's okay. You just want to at least stick in simple stability exercises, right, that you can do at home. Use it breaks from other activities, uses breaks from sitting, and focus on that foundation and keeping that sturdy if other things have fallen off and if you're feeling overwhelmed. So just don't let everything fall off the wagon. Maintain those most important things related to your compensations, right? Is it your SIJ that's always struggling? Are you a shoulder pain type of patient? Are you a lower extremity CRPS person? So whether it's that desensitization or stability piece, that will keep you from sliding back as much. And then when you have a bit more capacity, you can pepper back in more of that strength training and split that up too in a way that takes less of a toll. So you don't have to go through your entire workout if you don't have access to things or the environment's different or your stress is much more. break the workout itself apart, right? You can just do pairs of movements. You can pick movements that are less tiring than other movements and veer a little bit more accessory stuff rather than like compound multi-joint, squats and deadlifts. That's more zapping for your nervous system. It's more concentration and coordination. And so that's okay if it's not the same, just spread it apart differently. And if you're somebody who isn't, in that bucket of things yet, and you're still much more isolated kind of in the PT area of things, I like the term I use is movement snacks. So just kind of sneak in these movement snacks and these bite-sized sessions that are far less overwhelming, than doing an entire, like I said, full body resistance session when your head isn't fully into it yet. So me too, when I fall off, I don't go straight back into 3 times a day, full body in the gym. I get all my stability back on board. That feels easy. And like, it's not, hard to meet that. And then it's not difficult to layer in more. And you're back to, closer to where you were. So you don't have to do everything. You can't do everything at once, but you pick the most important things and then build on those for yourself. Fun, right? Aerobic exercise too. Right? You don't have to do like your whole normal hour. You don't have to do as much of it. Spread it apart, split it up differently.
Very good.
And then reorganize yourself.
Little bits, keep going. It's okay. Yep. You're not going to get it all in. It's all right.
Little bits. Yeah. Yeah. And just like we slide back, we also build back, so I have to remind myself too of, yes, I feels like I slide back fast, but I also do get back on track quick once you get those things integrated, and they're not going anywhere.
If you do have a prolonged period where you don't do your normal exercise, so let's say you've got a 2-week period off where you're like, I've done nothing. When you come back into it, don't come back in at where you left off. Because what you will have had is a small amount of deconditioning during that period of time. Come back in at 50% volume, do a couple of sessions at 50% volume, and then you can ramp it up. I think a lot of the time, what happens for a lot of people is that they're like, I didn't do anything. I just did what I normally did. I've been doing this for years. But what it's come off the back of is a period of not doing what you've normally done for years. And so you come back and that's all of a sudden too much load. And so you then develop an injury, flare yourself up because you're just doing the normal stuff. And it's the 2 weeks of rest beforehand that results in the deconditioning. So just as a little trick, just come back in after I'm doing nothing for 2 weeks. Fantastic. Enjoy. Come back in at 50%, do a couple of sessions and then ramp it up again. And you'll just dodge that overload that you might get.
Yeah, you can't go from 0 to 60. And a lot of the hiccups also come from not warming yourself up properly, right? Not kind of letting your nervous system know you're coming, not winding down and down regulating after, so that you're going from, parasympathetic sort of state to more excitation. And that's jarring for your nervous system if you have complex pain or things like CRPS and nervous system dysfunction. So that's a piece of it too, where yes, let yourself gradually get more used to it. And then you don't have such a response and you can get back on track quicker.
Next one, managing the crappy family.
Ooh. Our favorite. All right. Family social stress. Number 1, limit exposure. So who are your most triggering people? We know this about ourselves. Like dose response is not just for exercise, it's for people. So think of how much you're willing to tolerate. Think of what you're willing to expose yourself to, right? What are your boundaries, whether it's conversation related or it's just straight up time limits, like at 30 minutes, I'm done with this person, pull the plug. And Thanksgiving is a classic one in America where it's like, oh, what topics and, awkward conversations and political stuff is going to come up. And you are in charge, of what you engage in, and you shouldn't feel pressured to necessarily participate in certain conversations. You can just use it as an excuse to take a break, excuse yourself. It's fine. Just being there is a good amount of effort, and you don't have to partake in every single piece of, the event and who is there. So manage yourself, right? If you get a little, use your mindfulness and your down regulating breathing techniques, wink, wink, episode 39 for mood and stress management strategies on that you can apply to this. And I think the other piece of things is, I know I have struggled with this. Sometimes it can be extremely frustrating to feel like other people don't care, or you're not understood, or you're not accommodated. And although that sucks, the reality is that we can't control other people. And the best thing you can do is have all the strategies you need for you to help yourself. Like we just talked about from a travel, flaring, communication perspective, so that you're not as reliant on other people giving a crap, because that's just not how it works all the time. People are distracted. And if you can feel less helpless in that situation, it helps a lot.
And I think the important thing there is,
because it's hard.
You got to remember, none of this is in your head. And for all those people that make you feel it is, or simply don't understand, just go with the old chestnut, want to swap. Yeah. Make sure you just,
there we go.
And make sure you deliver it with want to swap. And then you've got to be silent. So
yes.
The pause is key.
The pause is
just
key.
Just to have them step into your shoes and then go, I don't want to swap. And then that ends the whole process. So, and hopefully it allows them to,
as the kids would say, mic drop.
Hopefully it allows them to understand a little bit about your position and your experience in the world, because they take that brief second to step into it and then go, I'm stepping out. So don't forget it.
Yeah.
Want to swap.
It's hard.
All right. Managing loneliness, which is obviously maybe the opposite in some ways of managing the family. That's, I think it's a little bit more difficult at times.
It is. I think it's a lot more difficult. And you can also feel, even if you have a family, but they're smaller, you can feel very alone and isolated, even if you're around people. Because with chronic pain, it often feels like you're having this completely different, parallel experience to the people that are around you, because you are in such a different place and space with what you feel. But the holidays are hard because there is such an element of missing out and wanting to do more, and reflecting and thinking back to the way things used to be, and who used to be around. And I think it's human nature in ways to resist change, and regular people have a hard enough time with that. But when people that you loved aren't there anymore, and you also have this element of grief and loss, it can make it really, really sad. And I know for me, over the brain injury years, the hardest part of it was that it was such a stark reminder of the different direction my life had taken compared to what I thought it was going to be and where I thought I was going to be. And there was no point throughout the year that held that up, I felt, and really shoved it in my face the way that holidays did, because it's this inadvertent comparison of where we are and what's new and jobs and kids. And, and I didn't have any of those positive things to share. And that also made it very lonely and made me feel very different. And so understanding, just like with flares, that this does not necessarily last forever. And it doesn't always have to be like this. And I remember thinking things could never change, and that made holidays really, really sad, because they're a reminder of everything I lost and wasn't anymore, and thought I would never feel or have again. And so if you're in that space, what I would ask is that, you too try to broaden your perspective again, and remember that things do not have to stay like this. And if you can focus on the things you can control and that you can impact, and the things that are still good and are still worth it, and they don't have to be huge things. They can be those small things throughout the day, or just glimmers that give you meaning and remind you of, who you were, and pieces of yourself that are meaningful to you. That can also be enough, because holidays don't have to be this big, huge deal. They're just another day in the calendar. They're just another month. And if you put that in a little bit of perspective, I think that can help the overwhelming sadness and grief that I perpetuated with myself too, because it meant so much to me, instead of kind of being it's not the biggest deal in the world. It's just a day. But it does feel like that, and it's hard. So that's all valid. And, try to find connection where you can. Again, reach out to those people that you do feel close with. It doesn't have to be your family. And, you're not a burden. Even if you don't feel like you want to be there, or you feel like other people don't want you there, they do. Even when I didn't want to be here, people wanted me here. And you just have to show up and be present as best you can.
The concepts around integrating gratitude and just being able to be thankful for the little things, even though life's hard. And
right. And because both can be true.
And making that effort maybe to be overtly grateful to somebody else can be a positive way to lift your mood and just say thanks. And then, try and create that little bit of a connection with somebody that you may not have at the moment, but you may have the opportunity to build it into something.
Yeah, just shifting that attention, shifting what you focus on, right? That too is mindfulness, and filtering doesn't just go for pain. So it's like I all those really sad years really focused on the really, really sad part instead of what I could have maybe given more attention to and given even myself more credit for. So if you're in that space, hang in there. It will soon be January and life will go a little more back to normal. But
if you want to listen to some other strategies, episode 39 on mood and stress management techniques takes everyone through a detailed set of strategies in that episode. So if you feel that something like that would be more useful, maybe turn this one off and go listen to that one.
Yeah, especially if you're in the overwhelming environment, then it's the mood and stress. Yeah.
The last bit is kind of like a me thing, which is like, how do you manage the doctor world all going on holiday? Because we do.
It is significant actually, in Australia.
My nurse was talking to a patient yesterday, and the patient said, well, I suppose he's allowed to go on holiday. Yeah, I know. I was like, okay.
What? Doctors are...
Anyway, look, I think there's a couple of different things. One of the things I'm doing for a couple of patients today is just going through their pain management strategies over the next 4 weeks or so, so that they do have things in place for if they flare. The other thing that, from a doctor perspective, is important is just working with some colleagues to be able to back you up. And the way that you get, or the way that your colleagues will back you up over the Christmas period and your holiday period, is you back them up when they go on their holidays. And so, for me, one of the guys, Zia Rain, that I work with, is covering all my patients, and Guy Buchanan will be helping support him. But throughout the year when they've gone on holidays, I look after their patients. And so there's not even, it's kind of a little bit of an expectation between us that I'll look after you, you look after me, and it all goes well. And I think that it's just a little bit of giving to get that support back is a very easy way to go about looking after things. The other thing that we have for the clinic is we have an after hours number. And the after hours number is, either gets picked up by myself or by the doctor that's on call. And it's been one of the best things that we've ever done. Like, people only really call when they really when things are very much gone pear-shaped. And I'd just rather sort it out. So it's much easier to sort out on the phone, and when things are stressful, than sort it out 5 days later when things are completely out of control. So that's been a good move for us, and it's been very effective. Yeah, it's good. I like it.
Positive. Yeah. And if you're a patient, don't call in November and then be furious that you can't get in December, right? So it's like, plan ahead. Know people are going to take time off. You're going to flare, or if you're going to travel again, like, these things are all reasonable desires when you're a patient, but if you leave it for the last minute,
bad news where humans too,
it's not going to happen.
Yeah.
And then everybody's pissed. Yeah. So be proactive, think ahead. I too have been there. It's like, what do you mean I can't get in for 3 months? Right. So it's not any better in the holiday season. So, doctors need vacation too. They are human. And don't put yourself in that position, because then you're shit out of luck without anything to do other than your normal stuff. And that's a bummer. So integrate all the strategies you can from a conservative perspective, plan and prepare yourself. If you're traveling, prepare yourself for the people you're going to be around, for the environments you're going to be in. If it is a real heightening of depression and sadness and those type of pieces, right, set yourself up for some increased connection and joy. Know that you're going to need that. Think about who you can connect with, virtually. That's the beauty of social media. And a lot of the people I work with is we all struggle with isolation in ways, actually all the time, not just around the holidays. And so how do you connect with people? How do you find your people who are like-minded and understand, what you're going through without dragging you down and also being very, very negative? And that's the challenge in the pain world when you're a patient, is finding the people that get it, but also lift you up. So be proactive. It's okay to be sad and overwhelmed. And if you've fallen off with your movement routine and all of your normal stuff, just lock in on the things that for you make the biggest difference. Slowly, get back into the movement habits that are most important, and then build from there as far as the challenge, and the increase in intensity over a few weeks if you've had a real deconditioned period, which is okay. Life will go on.
All right.
Happens to me too. It's fine.
Happy holidays.
Yep. All right. It's like, get me out of here. Almost home. Bye. Happy holidays. And we will see you. We'll have some more episodes after this, but we will then see you next year.
All right,
It's Not In Your Head podcast. Thanks, guys. Take care. Bye.
Thanks for listening. Clearly, this is a podcast. It's for informational purposes. It's not a consult, medical advice, or the practice of medicine, and it doesn't form a therapeutic relationship. If you feel the information might be useful for your situation, before applying it to yourself or others, you should speak with your doctor or your treating clinician. Do not delay in seeking a diagnosis or treatment, and applying the information is at the listener's own risk.